Hi, this is Dr. Antolak from thegentlедentist.com in Shelby Township, Michigan. 586-247-3500 is our phone number. And I'd like to just discuss something that's a little bit on the controversial side of dentistry, and that is the difference between silver amalgam, which contains about 50% mercury, and the tooth-colored composite materials, which are plastic material. Dental amalgam has been used for over the last 100 years. It is a very effective way of restoring teeth. It contains about 50% mercury. That mercury is, when it's mixed up and then placed in the teeth, it creates what's called an alloy, so it becomes part of an amalgamation or an alloy material, and it hardens up and it becomes, most everybody who's listening to this now has dental amalgam in their mouths. And it's been used for years very effectively. The disadvantage of amalgam is that dental amalgam, number one, contains mercury, and we all know the effect that mercury has on our brains and on the developing body. And this is kind of controversial because we know that in the Scandinavian countries, amalgam is completely banned. The American Dental Association, our country, said it's okay to use. The FDA was on the fence about it, not knowing what to say about it. But the amazing part is that we are required by law that if we place dental amalgam, that the scraps that are left over, that they have to be disposed of in a certain way because they wouldn't want it to get in our water systems. Now, does that make sense to you? If we can't have it in our, so they say it's okay to keep it in your mouth where the mercury vapors continually are evaporating, and that's in mercury in a vapor state is the dangerous part. But yet they say that it's safe there, but it's not safe to throw away in the trash or put in our water systems. Now, I'm not condoning putting in our water systems. That's pollution. We have what's called a mercury separator here at our office, so we take any of the amalgam stuff that goes into our suction unit, and that all gets disposed of properly like I'm describing. But I'm just saying the position, that doesn't make a whole lot of sense to me as far as being safe in the mouth but yet being unsafe in other environments. But that's amalgam. And another problem with dental amalgam is that dental amalgam does not bond teeth together, but over time it starts actually expanding. During that expansion process, teeth will actually start to become fractured. You'll see cracks in teeth that will take place from the dental amalgam. On the other side is composite resin. It is first of all, it's kind of a doughy material, and we can place it and bond it right onto the tooth structure, and it helps to bond the weaker parts of the tooth together. And dental composite is a plastic material, so it hardens up right away with our little ultraviolet light that we use that will help to set the reaction. But the thing about it is that it helps to bond the teeth together. Now, there are some questions about if composite materials will over time leach out certain materials, and the studies are a little inconclusive with that, but we believe that they're very safe. There's a third option, actually. It's called glass ionomer, and glass ionomer is a type of material that is a very positive material. It's good for people who have dry mouths and who are really prone to having dental decay. So there are a number of different options out there. Unfortunately, insurance companies, I'm going to put them into the mix here, insurance companies want to pay for the cheapest alternative. And that means that dental amalgam for the back teeth, they're going to pay for that, and only that. It's much faster of a technique. It's much less technique sensitive. Teeth can be wet. You can still put amalgam in there. When you look at composite or even the glass ionomer, the teeth cannot be wet. They have to be treated a certain way. The technique takes a lot longer. Therefore, the fee is a little higher with the composites compared to the dental amalgam. But do you want something that has mercury in it? I don't know. It's your own decision. And also the aesthetics of it is, when you smile and you show a bunch of black teeth, it doesn't look so great. Comparing that to having tooth colored, where people think it's all natural, it looks natural, it looks nice, it's bonded together. that's my choice. That's what I have in my mouth. That's what I have in my children's mouth. That's what I have in my wife's mouth. So if there's any questions about this, I would be more than happy to answer them for you. And my phone number is 586-247-3500, and we are at thegentledentist.com. Thank you.